from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we kick off the first of a three-part series about maternity services. This week, we're talking about prenatal care and healthy pregnancies. Our guest today is Dr. Mallory Littman, an OBGYN with First Physicians Group here in Sarasota. Dr. Littman, thank you so much for joining us.
Thank you for having me.
Let's start with the basics. Okay. We always try to. What does prenatal care encompass and why is it so important?
So prenatal care really involves education and health promotion. A lot of education about healthy habits to adapt in pregnancy, screening tests, and how to maintain your healthiest self during pregnancy and the postpartum period.
Seems obvious, but how does it differ from pre-pregnancy care if a patient has already been going to an OBGYN?
Sure. So hopefully everyone has been already going to an OBGYN because pre-pregnancy care really involves health optimization. And so, for example, maybe adjusting some medications that are a little bit safer in pregnancy, weight changes, either gaining, losing, or maintaining, exercise habits, diets, and then sometimes some pre-gestational screening tests, genetic screening tests, things like that.
And can you discuss the importance of being an established patient as the pregnancy continues in case of emergencies?
Sure. So most pregnancies are really happy and exciting times, but then there can be some very serious complications that occur during a pregnancy, and some of them can occur even before a woman knows she's pregnant. And so for those situations, it's very helpful to already be established, have a place to go, someone to call in case any of those things do happen. Or if you're not established, of course, you can go to the emergency department and they can help direct you in appropriate place for long-term management, things like that.
Can you talk about the importance of that prenatal care and the relationship you develop with your OBGYN over going to a hospital that delivers and delivering with whatever doctor's on call?
Right. So throughout your prenatal period, there's going to be a lot of screening and monitoring and a constant balance of the risks the pregnancy poses to you, the risks potentially poses to baby, and balancing that. And you want to feel like you trust that person that's guiding you through that you can confide in them. They're probably going to be a provider working more intimately with you than any other provider has in the past. So you want to feel comfortable with that person so that you can safely navigate that together.
Now, for those who are listening to this podcast instead of watching it, you won't see it, but I am 8.5 months pregnant myself. So I'm in this process. But Dr. Littman, for those who might have just recently learned they're pregnant and are beginning their prenatal care journey, what are some of the big milestones they can expect in their care with their OBGYN?
Sure. So prenatal care is going to look different for everyone and may vary slightly from office to office as well. The first appointment is probably a big milestone. Establishing that rapport with your obstetric care provider often involves a comprehensive review of your past history, medical, surgical, obstetrical, social, etc. Some basic lab tests that are ordered at the beginning of each pregnancy, and often also involves an ultrasound. The earlier an ultrasound is done, the better it is for dating a pregnancy. That early ultrasound is often a transvaginal one because that is the most accurate way to date an early pregnancy and also visualize the ovaries as well. So that's that first milestone probably. There sometimes is an ultrasound around 12 to 14 weeks to screen for some chromosome anomalies at that point. Then a comprehensive anatomy ultrasound between 18 and 22 weeks to look at all of baby's developing parts. The glucose screen is anywhere between 24 to 28 weeks to screen for gestational diabetes. And then in the last month of pregnancy, those appointments are usually every week. Those appointments also involve checking a blood pressure, a weight check, fetal heart tone check, and then usually scattered between those some education material about prenatal progress, vaccines, breastfeeding, postpartum, etc.
So I want to touch on a couple of those appointments. First of all, the initial appointment, something I didn't realize until I had my first child. You don't take the test, find out you're pregnant, and go to your OBGYN. There's often a waiting period. Why is it that most OBGYNs request that first appointment be at that 8 to 10 week mark instead of, you can find out as early as 4 weeks pregnant?
So early on, it can be hard to see on ultrasound.
Okay.
But that early ultrasound is the best time to see what we need to see to date the pregnancy. Also provide helpful guidance, education to keep the pregnancy healthy. And then also there's some blood work that can't be done until a little bit later in pregnancy.
Makes sense. And we're going to talk in the next episode of this maternity series with maternal fetal medicine about the glucose monitoring. So I won't go too much into that. But I did want to get your thoughts on why it's so important to make sure you're doing all the different tests, including that to monitor for a healthy pregnancy throughout.
Sure. So a lot of women that are diagnosed with gestational diabetes have no risk factors. It's one of the most common pregnancy complications. So therefore, the American College of OBGYNs recommends everyone get screened for it. It can have impact on mom and also on baby. So everyone is recommended to undergo that screening. And same with the blood pressures, can affect anyone with no risk factors. One risk factor, for example, is it being your first pregnancy. And so it's something that we want to monitor everyone for.
So for those who've had more than one pregnancy, how can a previous pregnancy impact their prenatal care for their new pregnancy?
So with most things in obstetrics, if you've had a history of it in a prior pregnancy, you're now at a greater risk for it in a future pregnancy, sometimes even at an earlier gestational age, for example, preeclampsia. So it's just something that may mean increased monitoring, increased screening, or additional screening tests, additional ultrasounds in your future pregnancy.
I don't know if you've seen it on the internet, but there is a lot of joking amongst pregnant moms who are on social media about those third trimester appointments, that they can be really quick and the doctor's in and out, or a certified nurse midwife, if that's what your doctor's office has, where they come in, they check you, and they're out. And it's kind of a joke that you don't even ask questions or anything like that. Can you clear up some of the myth why it's so important to still maintain those appointments?
Sure. So even though it might be really fast, hopefully that means, things are going well. It should be a time also to, ask any questions you do have, scatter in some educational material from your obstetrical care provider. And hopefully your blood pressure is normal. Hopefully your weight gain has been appropriate throughout the pregnancy. And so hopefully, baby's heart tones sound normal. And so all those quick, little checks, they're important, and we want them to be quick and easy. Unfortunately, fortunately, rarely, but unfortunately, sometimes they're not.
Are there any misconceptions that you often hear about prenatal care that you want to clear up, aside from what we've just talked about on social media?
It's hard to keep up with all of them, honestly. I think one is, and what you mentioned, being aware of who you're getting your obstetric care from. So, for example, a certified nurse midwife is a nurse practitioner that's gone through additional graduate level training, specifically in obstetrics and delivery, is very important and regulated, as opposed to a lay midwife where hasn't had that regulated medical training, therefore isn't able to have hospital privileges or provide medical care at a doctor's office. So it's important to just understand who exactly you're getting your care from. I think a lot of women sometimes feel responsible for something that happens during the pregnancy. And a lot of the complications in a pregnancy are unpredictable. And that's why we have those frequent prenatal appointments to monitor and screen for those things. But oftentimes it's not anything a woman did wrong. I often hear patients say, how did I do this to my baby? What did I do wrong? I think the first thing, if one of those complications does come up, is just relieving yourself of that guilt and knowing you did everything right by coming to your prenatal appointments.
That's a good point. Aside from attaining prenatal care, though, are there things that can be done to increase the chances of maintaining a healthy pregnancy?
Sure. So really, the healthier you are going into a pregnancy, the healthier the pregnancy can be. Pregnancy can serve as a great motivator for establishing a healthy exercise routine, a healthy diet, maybe smoking or alcohol cessation. And so more of that you bring in going into the pregnancy, then the healthier the pregnancy potentially could be.
So as a pregnancy progresses, symptoms can change quite a bit. How can a patient find out if what they're feeling is normal or something more concerning? Because we all know that typing your symptoms into the internet is a bad idea. No matter what, whether you're pregnant or not, usually the internet tells you something terrible. So how do you go about having a conversation with your provider about the symptoms you're experiencing and whether or not they're normal?
Sure. So your provider will probably talk with you about some big red flag warning signs where you just need to go to the hospital. But a lot of, everyone feels different symptoms during a pregnancy and experiences different things during their pregnancy. And the best thing is to just ask and, call your office, figure out if what you're experiencing is normal or abnormal.
And it's not just person to person, it's pregnancy to pregnancy. It can be completely
Absolutely.
different symptoms.
Absolutely.
I'm experiencing that now. There are a few different times during pregnancy that lab orders are sent for different testing in regards to healthy pregnancies. And there are also a number of recommended vaccinations. Can you go through some of those recommendations and when those vaccines are given?
Sure. So now there's up to 4 recommended vaccines in pregnancy. The first 2 I'll talk about are flu and the COVID vaccine or booster. Women's immune system is slightly suppressed during pregnancy, and then additionally, with the growing uterus, there's more and more pressure on your diaphragm, decreasing your lung capacity. So women are at increased risk of certain lung infections. So by getting the flu vaccine and the COVID vaccine, that's decreasing their risk of becoming very infected or sick during the pregnancy, which of course could affect them and then also the baby. A benefit of getting vaccinated in pregnancy is that as mom makes antibodies for herself, those antibodies are then also passed to baby to provide immunity for baby, often even longer lasting, we found, than natural immunity. Then there's 2 other respiratory infections that aren't usually very severe in adults, but can be very severe and life-threatening for babies. So that's the pertussis, which is actually on the rise in our area now, and that's in the Tdap vaccine, tetanus, diphtheria, and pertussis, and then also the RSV vaccine. So mom gets that vaccine during pregnancy, creates antibodies that then are passed to baby.
So for those who have concerns about specific tests, for example, the glucola test, which there's been a lot of concerns and misinformation out there, or specific vaccine suggestions, maybe they're concerned with specific vaccines you mentioned. How can they address these concerns with their doctor and make sure they're getting the best information?
Sure. So I think a lot of these tests or vaccines may seem very routine and standard for your obstetric care provider, and they may kind of just bring them up and not realize that you have concerns or questions about them, or maybe less familiar about them. So if you do have questions or concerns, just bring them up with your provider. They should be really open to talking with you about whatever concerns you do have, and should be able to also point you in the right direction for reliable educational material too.
Once a child is born, obviously their care shifts to a pediatrician. But can you talk about what medications are recommended in the delivery room and given by the OBGYN and delivery team at the time of delivery for the child too?
Sure. So there's 2 medications that are recommended in the delivery room. One is an antibiotic eye ointment that helps protect infection from bacteria that could cause blindness. And then the other one is vitamin K. So in adults, our livers synthesize vitamin K, and we use that for clotting cells, for us to make our clotting cells. That's very important for babies. As they've gone through a delivery, they're at a higher risk of having bleeding or hemorrhaging in the brain. Their livers aren't yet synthesizing or making vitamin K, so it's important for them to get that vitamin K medication so they can make those clotting cells.
So before we go, I know we've touched on a wide variety of topics, and there's a lot that can happen in 9 months of pregnancy and delivery, but is there anything else specifically you want to add about healthy pregnancies and deliveries for the community or any parents-to-be?
Yeah, sure. So pregnancy is often, a very exciting time, very, very happy time. But there can be some unpredictable things that happen, and a lot of them are out of our control. And I hope I didn't scare anyone talking about those things today. Most people will have a very healthy, very normal, happy pregnancy. But to navigate those waters, you want to be established with someone that you trust, that you have that rapport with, so that you can kind of go through those risks together, and they can safely navigate you and your baby to a healthy delivery.
Great. Dr. Lippman, thank you so much for joining us today and answering all these questions.
Thank you so much for having me.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.